guys, this is Dr. Xiang Jun, the modern traditional doctor, and you know that I'm not just a TCM doctor. Alright, because some of my patients and my friends actually tells me the videos that I made initially, like the last few ones, some of them you can't hear them well because I'm using a wired microphone. So while my patient actually suggested me to get the earpods, which I actually went to get it and it's here, so hopefully you can hear me better. Okay, so I'm just going to reiterate the past few videos what I have talked about, yeah, so that you can understand what hip balancing is all about and the importance of that. So in the first video I actually talk about how do you know your hip is imbalanced. Well, basically, if you have the tendency of crossing your legs when you are sitting, you know, that may indicate that you have an imbalanced hip because the body is actually trying to balance itself by tilting itself. Alright, so if you are balanced, you should not want to cross your legs. But if you are already imbalanced, then the body will actually want to cross the legs to find the balance again. So that is one indication. And also the second indicator is that when you walk, you can take a look at your soles. So usually when the hip is imbalanced, one leg will be slightly longer than the other. So the longer leg actually will have more friction along the floor as you walk. So when you look at your soles, sometimes one sole may be more worn out than the other. That may be also an indication that your hip is imbalanced. But to double check that and to confirm that, you have to go to a professional to actually assess you and check you out whether your hip is imbalanced or not. So that's in the first video. Alright, then in the second video, we talk about why do you want to keep your hip balanced and what's this hype about keeping the hip balance and why am I actually promoting that in one of my signature therapies. Well, basically, if your hip is imbalanced, well, the hip is like a second head. Basically, it holds all the vital organs as well, just like the skull holds the brain. So the hip actually holds the vital organs like the reproductive organs, the bowels, the urinary bladder, and a lot of lymph nodes are found in the hip region, the pelvic region we say. So if your hip is imbalanced, so one side is collapsed, so basically that side is going to have poor circulation, and when that happens, toxins can accumulate. So that may be the reason why a lot of people are having cyst fibroids issues and also infertility issues and a lot of other issues. So that's from the internal disease kind of standpoint. And the very obvious one is that you may have very chronic low back pain, neck pain, knee pain, ankle pain, which the hip itself is the axis of the whole body, is the center of it, is the fulcrum. So basically, if this fulcrum is imbalanced, it's going to either spiral upwards to the neck region where you're going to feel a lot of pain all the time, or it's going to spiral downwards to the knee region, ankle region, where you're going to have a lot of pain, and you go to a podiatrist, physiotherapist, and they keep treating only that area, but you get no recovery. So why not? Yeah, the root of the problem may be coming from the hip, but as well. But I mean, you have to still go to a professional to have it checked and assessed. And it really depends on individual practitioners, their belief system. For me, I do believe that it's coming from the hip. That's why I always promote this hip balance therapy. And in the third video, I actually talk about do I support cracking of the joints. Well, basically my answer is no, and especially for frequent cracking of the joints. So actually what happens during the cracking of the joints is that you basically rapidly detach the joint, and then there is a small air bubble that's created, and then when the bone actually rapidly is realigned back, it actually snaps this bubble and causes the pop sound. So what it does, it quickly gets the joint back into alignment, but frequently doing that actually will cause a lot of damage in the internal joints, and actually it will cause like the loosening of the joints in the future. So basically, like when you just have a wrong posture, the joint will get misaligned easily and it will press onto nerve, and you're going to feel a lot of pain very easily. So I mean, I also do crack my patients sometimes when I feel the need to, but I don't suggest you to do it very frequently, like twice a week or once a week for many months, because I've seen that in clinicals in my practice. A lot of patients who have done it very frequently actually has a lot of pain issues, and their structure is not strong enough to hold a wrong posture. It's just a wrong posture maybe for one night, like their sleeping posture is not good, and the next day they suffer from a lot of pain thereafter because they have loosened their joints from frequent cracking already. So that's my standpoint for the cracking of the joints. And then to talk about what this hip balance therapy is all about, basically I went to Japan and search out a master basically, and he doesn't really teach, and there is a lot of prerequisites before you can actually learn from him. So yeah, so I call this the osteopathic hip balance therapy. So basically, for osteopathic hip balance therapy, we don't do cracking, but we do repetitive readjustment of the joints with you in certain twisted positions to get the joints back into alignment. So at this level, we are working at the tendon, the myofascial level. Then for cracking of the joints, for my other practitioner friends out there, they are working more at the bones level. So they just immediately want to get the bone to alignment, to shift the bone, the compression out of the impingement of the nerve. Alright, so but for this hip balance therapy, it's more for a long-term purpose. Okay, is to get you balanced into the structure for the long term, not for short-term sake. Alright, so there's no cracking, but sometimes when I adjust you, there may be slight cracking, but it's very small, and that's not my whole intention. Well, and the treatment course is not going to be very short. It's going to have a few sessions, so it's actually to get the body into the right alignment over a period of time, to get it into the memory of the right posture state. Alright, yeah, so feel free to come and have an assessment, alright, and yeah, if you are ready to be adjusted by me, yeah, feel free to do so, and I'll advise you from there, and also advise you how you can actually keep your posture more balanced, okay, by your daily lifestyle activities, alright. Yeah, so that's all about the hip balance therapy, and if you have any further questions, you can always PM me in my Instagram or using the Facebook Messenger, and my website enquiry form is always there, so you can just type in whatever questions you have about this or anything else that you're concerned about. Alright, so I'll talk to you soon.